Working in the CCG for me was the first time that I'd come together with clinical colleagues to work on things that would make a real difference, and finding an organisation that was clinically led and supported by the whole of the managerial team was a fantastic way of working. And I think because of that, we've made some changes and some differences that have meant really positive outcomes for patients.
We made it a priority through collaborative working between the hospitals, the community trust, GP practices, CCG managers and the hospice. As a result, we were able to develop and put on an integrated specialist palliative care service where nurses, doctors, patients, carers, out-of-hours services work together to support patients.
The overriding thing for me is about how we've always come back to what would it be like for the patient and kept the patient at the centre of our commissioning decisions and what we do and what we don't do actually. And that's been a theme throughout the 7-8 years that I've been at the CCG. And it's a really nice thing to see that that idea of keeping the patient at the centre and doing what's right for them has gone on and into the ICB. So for me, that's the thing I'm going to take away most about East Leicester CCG, and also working with some fabulous people.
CCGs have been really unique in the history of the NHS in that they have been clinically led organisations, with all the GP practices in the City of Leicester being members of the CCG. As well as having clinical leadership, the CCG has also had superb management support and also has been led by lay members as well, who have been involved in the governance of the organisation.
Greetings from the NHSE Midlands Regional Team. I've got so many positive memories of my 8 years at ELR CCG. What I'm most proud of was the way that the managers and GPs worked as one team with the explicit aim to support general practice to deliver the highest quality, accessible care to our population.
I'm really proud to say that we work as a family and the whole team brings about a change for the betterment of patients and clinicians to make life easier for both of us. Launching the respect forms was one of the highlights of my working there, and as was launching the 111 first and working on the board for urgent and emergency care. It has been a long journey, but I think it's always a start to a new journey, and I hope this one will be even better.
My proudest moment working for the CCGs would have to be the Better Care Fund, and the way that our healthcare teams, our social care teams, our GPs, our hospital teams, our ambulance teams all came together, looked at a problem, solved big parts of the problem actually, and gave the population of the Leicester City CCG certainly some of the best services that we've seen from an integration perspective for a long time.
So probably 3 years ago now, I set up the LLR Academy with my good friend and colleague Veena Katecha, who's the Ordinal System Lead for Organisational Development across LLR. The purpose of doing it was really to bring to life the concepts within the person-centred leadership framework. So with the common purpose of creating more good days for our patients and our staff.
My experience has been really, really great since I've been here. I've been here now for 2 years, and I found the whole of the teams and the staff to be really, really inclusive and very, very friendly so far, and very easy to work with.
I came to work in the CCG in 2011, and I moved from the Acute Trust. And actually, my most memorable thing is actually realising how good commissioning was and actually what was involved in working in the CCG. I had no idea, despite having some 30 odd years experience in the NHS, and I've loved every minute of it.
I'm really proud of the work that we've done in the pandemic on the COVID vaccination programme, where we've worked across the system with every partner, not worried about barriers, coming together with a focus to make the whole system and our population safe.
My My most memorable moment is when we set up the testing for COVID 2 years ago, as we just hit lockdown, and Leicester was definitely in the press for not all the right reasons, but the work we did absolutely helped in shaping what testing looked like nationally, so that was something that I was very proud of.
Between about October and December 2020, I was part of the CCG team that actually set up the vaccination centre here. That was just one of the best moments of my professional and personal life. It was marvellous to work as part of a team. It was marvellous to be able to get all those people through the door, especially on the first day, very emotional, to be able to get people to have the COVID vaccine. I couldn't have been happier, I couldn't have tried harder, couldn't have worked harder, and I think we really worked together to make a successful vaccination programme for the people of Leicester, Leicestershire and Rutland.
My best engagement work for West Leicestershire CCG would have to be the work we did with frail and older people. Really pulled out the emotional aspect of care, which often goes unmentioned. Best memory would have to be the New Year, New You work, where we had both patients and staff all working together.
So there have been so many great moments, I think, over the last few years, but I guess the one that really stands out for me was the moment when the 3 CCGs took a vote with the GPs and they voted unanimously to move forward to create a single commissioning board for Leicester, Leicestershire and Rutland. That was a really significant and brave decision that GP leaders took in this area, and I'm sure it's going to be the foundation for success for years to come.